So this topic is about the joints and what is the biomechanics. Basically, the footwears play a critical role in human movements and the postures. It influences how the force are observed, transmitted, and distributed during activities like the running, walking, and standing. So improper footwears can lead to the injuries. So now we define what is the biomechanics. Basically, biomechanics is the study of the mechanical principles applied to the biological system. It involves the forces, motions, joint mechanics, muscles functions. In footwears, it has been focused on the ground reaction forces, joint loading, and the muscles activations patterns. So now we define what is the kinetic chain. Basically, the kinetic chain is a concept describing how body segments work together during the movements. So the movements at one joint affects other joints. For examples, the foot which will affect the ankles, knees, hip and spine. It can be open kinetic chains and the closed kinetic chain. So this picture describe the kinetic change which depend on the different joints. Like the upper one is the cervical spine, then it connect with the thoracic spine, and then the lumbar spine, hip joints, knee joints, and the ankle joints. These are the kinetic chain. Now, what is the importance of the foot in the kinetic chain? The foot is the first contact point with the ground. It acts as a shock absorber, balance controller, propulsional lever, and any abnormality in the foot mechanics affect the kinetic chain. What is the basic foot biomechanics? Basically, the key movements such as the pronations and supinations, the normal gait requires the control pronations for the shock absorptions, the supinations for the propulsions, so the footwear can enhance or disturb this balance. Types of the footwear. So there are different types of the footwear like the athletic shoes, the minimalistic footwears, the high heeled shoes, the flat shoes, the orthopeds or footwears or the barefoot conditions for companions. So the athlete shoes is basically the biomechanical effect. They having the crotinoid soles reduce the impact of the forces. Are suppose the control excessive pronations, and it heel to toe drop the effect of ankle and knee loading. So what is the effects on the kinetic change? Basically, it reduce the stress on the ankle and the knee. It improve the shock absorptions and it may reduce the injury risk when properly designed. Minimalistic footwear. So there are the characteristics of the minimalistic footwear like thin sole, no arch support, low heel to toe drops. So the biomechanical effect may be increase the foot muscles activations and promote the forefoot strides. So it effect on the kinetic change. It may be increase the load on calf muscles and Achilles tendons. It reduce the knee joints loading and risk of the injury if transition is too fast. So the high-heeled footwears may be the biomechanical changes. It increase the plantar flexion, alter the center of the gravity, and reduce the base of the support. It also affect on the kinetic chain like increase the knee joint the compressions. Anterior pelvic tilt will be observed and the lumbar spine stress can be observed. The higher risk of knee osteoarthritis will be occur. Flat footwear which we call the flip flops. Basically, the biomechanical issues may be the minimal support and the poor shock absorption will be observed, while the effect on the kinetic change, it increase the pronation, tibial internal rotation, knee valgus, and the hip and lower back discomfort will be observed. Orthopedic footwear. Basically, the purpose is to correct the foot deformities and provide the stability and alignments. So, biomechanical benefits are it improve the foot postures and redistribute the plantar pressures. While the effect on the kinetic change, it reduce the joint stress, improve the gait efficiency, and preventions of the overuse of the injury will be observed. So the bare foot walking, which we call the running, so the biomechanical effect is the natural foot mechanics will observe and increase the sensory feedback, while the effect on the kinetic chain it improve the proprioception and increase the foot muscle strength and higher the impact of force if the surface is so much hard. What are the effects of the footwear on loading? For example, in the innate, it causes the stability versus mobility. In the knee, the foot pronation affect the knee alignments. The hip, the footwear wear influence the hip rotation, and the spine alter the posture effect and the spinal curvatures. So, what are the muscles activations changes? Such as the footwears alters the timing of the muscles activations, the muscle fatigue pattern will be observed, the minimalistic shoes increase and the intrinsic foot muscles activity, and crush hold shoes reduces and impact related muscles demand will be observed. Footwear and the injury risk. Improper footwear may lead to the plantar fasciitis, shine splints, and they also observe the patellofemoral pain and the low back pain. The correct footwear help to maintain the alignment and reduce the overuse of the injuries. So the clinical and the supportive applications are used in the sports performance optimizations, injury preventions, and rehabilitations. Footwear selection should be based on the foot types, the activity level, and the biomechanical needs. So, as a concluding marks, footwear significantly affect the biomechanics and the kinetic chain. Poor footwear choices can disrupt the alignment and cause the injury. So the proper footwear enhance the movement efficiency, joint protection, and overall performance, which understanding the biomechanics is essential for injury prevention. So this topic is all about the biomechanics and the footwear. Thank you so much.